I'm Bill Lyons, and I'm a native of Southern California. I grew up in an agricultural county outside of Los Angeles. I went to medical school in St. Louis, but returned to California in San Francisco for internal medicine and geriatrics training. Working with geriatrics patients is a blast because this is a group of people who have a lot of life experience, they have a lot of interesting stories, they can share their wisdom with you. They tend to have a lot of diseases, so it's professionally challenging as well. And so it's really my favorite patient population by far to take care of. As a geriatrician, I take care of people with a wide variety of medical conditions. So I have gotten a lot of experience taking care of folks with, for example, heart disease like heart failure or coronary disease, lung disease like emphysema, kidney disease, diabetes. In the hospital, I help the surgeons take care of my patients when they have surgical problems like hip fractures. So wide variety of people with different medical conditions, and it's part of what makes geriatrics very fun. Nebraska reminds me of where I grew up. So I grew up in an agricultural county, Ventura County, between Los Angeles and Santa Barbara. You know, the crops are different that they grow there than here. We grew a lot of lettuce and strawberries and less wheat there, but it's the nature of the people that I love being around. I find Nebraskans are open and warm and they embrace you, and it's a great place to live and to raise a family. I used to be a chemical engineer, and I had done that for a few years, but decided that I wanted to do work that was more personal, where I had a chance to help people in kind of an individual way. So later in life, I went back to medical school because I wanted to do something scientific, but with a component of social service. So that's why I went into medicine. What I like working in academics is a few things. So one is it gives me a chance to see the most challenging patients because the community doctors refer them to you. Another thing is in academics, I get a chance to work with wonderful trainees who are interested in learning how to be the best doctors that they can be. And they also challenge you by asking questions related to why are we doing this or that, or how did you make this diagnosis, or what's the best treatment. So that keeps you on your toes. And in doing that, I find that with academics and the act of training these people, you end up giving much better patient care